You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I am sitting down with Ed Marx, who is the CEO of Divergent. Welcome to the show, Ed.
Thanks, Dr. Roxy. I'm super excited. I've been waiting for this recording to happen for several weeks now.
That's awesome. So glad to have you here today and to be able to have this conversation with a good colleague and friend. So let's start off, like I do every episode, by just telling our listeners a little bit about your background and what you are up to these days.
Yeah, it's pretty simple. I was 16 years old and working in a medical facility as a janitor. And while I was sweeping and mopping, literally, listening to Black Sabbath on my, a Sony Walkman or something, I just knew I wanted to be in healthcare. I just had this sense like, I need to do something in healthcare. And, as a 16-year-old, I didn't know what that would lead to, but it definitely planted the seeds. And so everything I did from there on forward was all about healthcare. And I had a traumatic experience one time with the birth of our oldest daughter. It all turned out good. But that's what led me to understand that healthcare, the technology saves people's lives. And I was like, I got to get on the tech side. Yep. And so I jumped on that bandwagon, the CIO track. And, I've been a CIO at several different organizations and now as a CEO at a Divergent.
So what does Divergent do?
Yeah, so Divergent is a consulting and services firm. And we're a mid-sized firm. And we help organizations in a lot of different areas, everything from staffing and implementation, which is sort of our initial strength and still is a huge strength of ours. But we've broadened that spectrum of services to include digital transformation. I know that's everyone's favorite buzzword. Health design, human-centered design in healthcare, helping with M&A, helping with cost takeout. So what we had done, about a year ago when I arrived is we just surveyed a bunch of CIOs and CEOs, the entire C-suite, and found out, hey, what's missing? What would you love to have from a single services firm? So we sort of built our capabilities around that feedback.
That's great. Co-designing your service offering. I love it. So you are the author or co-author of a book called The Healthcare Digital Transformation. So let's just talk about that a little bit. What are some of the key takeaways, maybe challenges that the ecosystem is still facing and some opportunities that are still right before us?
Yeah, one of the main reasons for writing this was like during the pandemic. Actually, it started right before, and then the pandemic happened. So we added, the whole concept. We didn't talk about COVID specifically, but we know COVID's not the only pandemic that will be in our future. So we really tried to pandemic proof, if you will, the book. But the impetus behind it was sort of a wake-up call for the provider side of healthcare to take action, to respond to consumerism. Because what we found is other industries were doing it and coming into healthcare, while on the provider side, we're sort of slow to react. We've been talking about, as one example, patient experience for 20, 30 years. We probably called it something different, but we've really haven't moved the needle whole much. And all of a sudden you have these new entrants coming in, whether it's retail, and immediately they're all about patient experience. And then you have big tech coming in doing the same thing and payers. And meanwhile, healthcare provider side, man, we've been kind of slow. So it's like a wake up call. So that's one of the challenges. It's like, you got to take action now. So that was the main, message.
So from your perspective, what actions did we take that were probably catalyzed by the pandemic more than anything? But what are some of those actions that we took and some opportunities that are still right there that still need to be taken advantage of?
Yeah, I think the most obvious one would be virtual care. Now, remember, we've been doing telemedicine. Like, I'm trying to think when I first got my first healthcare tech role was at Parkview Episcopal Medical Center in Pueblo, Colorado in about 1995. And I started doing telemedicine with the prisons. There's a big prison population in this part of Colorado. And it's like all the supermax and all that kind of stuff. So very expensive to bring the prisoners in. And so we started telemedicine back then, as I think everyone knew the power. And then, of course, consumers, that's what they got used to, all the automation and digital capabilities, everything in life, but certainly all the virtual type things. But we had very little adoption. And so, as you know, that was pre-pandemic. So in fact, at the Cleveland Clinic, where I served as CIO and responsible for the digital strategy, we had it in our plan, that 50% of outpatient visits would be virtual by 2023, right before the pandemic. So the pandemic happens and Cleveland Clinic goes up to 80%. Other organizations go 50, some go 90, some might be a little bit less, but everyone really grabbed onto it. It's like, yes, finally, right? We finally are doing it. But what happened is after the pandemic started to slow down, hospitals wanted to return to the old ways of doing things. And so we've seen that number, which was probably an average of averages of about 50%, going down to about 10 or 11%. But on the optimistic side, as my friend Chris Ross from the Mayo Clinic always reminds me, he says, Ed, that's 10% is 10 times better than what it was pre-pandemic. So we made headway, but meanwhile, we have virtual only companies coming in and the payers doing a lot of virtual capabilities for care and hospital at home. And largely on the provider side, it's still a challenge for us, right? We wanted to go back to old ways. It's comfortable. That's where our processes were. And we still need to ratchet it up so that we can be viable in our communities.
So one of the things that comes to mind when you talk about patient experience or you talk about telemedicine, these terms or practices that have kind of been around for several decades, the other one that comes to mind is interoperability. We've been talking about this word for a long, long, long time. I think a whole stage at the recent Vive conference completely dedicated to ongoing interoperability conversations. And so just kind of help us understand, are we really any closer? Are we even having 10% improvement in interoperability? And what are some of the challenges that we're still facing there?
Yeah, I haven't thought about a percentage, Dr. Rox. I think we've probably seen a 10% improvement. We have seen improvement. There's a lot of governmental pressure, and it's unfortunate when it requires governmental pressure, but sometimes it does. And so there's been some acts, as you know, and policy changes that encourage those companies that haven't been willing to share their data very easily, forcing them. But yeah, some of the challenges still historically and today are the cost, right? So these companies that do this, it's almost, it's almost copy and paste, but they still charge an inordinate amount to the customer and the customer can't afford it. So you still see that dichotomy happening. And then there's still this reluctancy. I mean, again, there's some vendors are sort of forced, not all vendors. A lot of vendors are really cool about it. And so you don't get the seamless experience. We'll talk about, patient experience should be seamless and frictionless, but it only can be that if there's interoperability. And so I still think we have a ways to go. Yeah, the discussion, you're right about at Vive. If you take that panel and you can have that same panel 20 years ago, we can talk about it. But again, on the optimistic side, we are making improvements. I just think we got to keep pressuring each other, holding ourselves accountable to one another, and ultimately never forget the patient, right? We both know that very near and dear, that if we keep the patient-centered focus, I think we'll all do the right thing.
So I'm going to get a little controversial here. I hope you're okay with that. So when we think about interoperability and we think about some of the incumbent players in the EHR ecosystem, I think in your book, you talk about how they are custodians of data. And, in my mind, I question whether those large organizations that are custodians of incredibly gigantic, large, data sets, are they stifling innovation or are they catalyzing it? So just kind of bear with me for a second. So one of the things that I really struggle with is as the legacy type companies are trying to come together and build out this perceived end-to-end interoperability. We also have all of these non-native healthcare companies coming into the ecosystem so we're never going to achieve complete interoperability. If Walmart's coming in and they are on task to build 4,000 primary care clinics between now and 2027 and end up being the largest primary care provider in the country, it's never going to integrate into the EHR system. Then you've got, Teladoc and you've got MD Live and Doctors on Demand, and you've got all of these patient-centric kind of like front door or virtual care solutions that are happening outside of the traditional ecosystem. So it just makes me wonder, how do we really need to think about transforming this, as opposed to some of our old ways of the health system is the one that kind of owns the entire care continuum, and we just need to kind of stitch those pieces together, and then we will have arrived.
Yeah, if we had the willingness, because the technology is there to have real play, I think, we wouldn't have this conversation. But the fact is that, like we established, that not all organizations or companies have been really assertive about sharing information and APIs and all those sort of technical hooks, if you will. And as a result, we have a lot of fragmentation. And then, to your point, there have been historically these companies that have sort of dominated. And so it really pushes out some innovation, because if you're saying, hey, just use my platform for everything, then in some cases, it might make sense. In other cases, it really stifles, different ways of thinking and doing things and taking advantage of new technologies. So I get that completely. I sit on the board of a couple of health systems now, so I see it in a new perspective. And hearing the CEO talk about, hey, we have system X and it's just consumed our budget, or there's nothing else to experiment with, to innovate with, and so we're just sort of going to down this single path. So it sort of can be stifling, and for others, just to be fair, it can be an equalizer for them. So they have a platform they've invested in, and they can sort of keep up with some of the other innovation. So it is a controversial thing. I think it depends on the situation of the particular health system. But all that said, I completely agree. We need the ability to have plug and play, copy paste, have seamlessness. It's like, that's the beauty of, right? Everyone talks about Apple, but it's true. And one of the reasons I used to switch my technology every year just to keep my brain alive and learn new things. But with Apple, they make it so easy, the interoperability. And I go to the App Store, it doesn't matter what app I bring, it integrates with the Apple OS. And that's what we need. We need this sort of healthcare OS, and everyone's plug and play. So it doesn't matter anymore. And we need to get rid of what's the word? Hierarchical, sort of, thinking that has stifled innovation.
So let's kind of talk about the patient experience. I know that you're working on a book around the patient experience. So, what are some of those, kind of like give a little teaser of what to expect from your book, and what do we need to be thinking about when it comes to the patient experience today and tomorrow?
Yeah, so really excited about this book. It's a collaboration with Chris Ross, Mayo Clinic, and Mayo Clinic Press. Specifically, all proceeds will go to cure cancer. There'll be a Mayo Clinic Foundation trust set up, and so all the proceeds will go there. So we're really excited about that. And it's targeted at the consumers. That's another unique angle of the book. So it's not written for healthcare, but it's written for the consumer who is either a friend or family member of a patient, or a patient themselves. And it's really meant to be a hand they can hold through their journey. Because Dr. Oxy, imagine, and I know you do this because we've spoken before, imagine going through healthcare and not having a friend like you or me to guide them. It's not a good experience.
Right.
And that's not right. And so we pretty much established, hey, we were very privileged. Chris and I, we went through horrid cancer situations, both healed now, but very privileged to be in, marquee health systems and knowing marquee people and all that kind of stuff. But not everyone has it. Everyone should have some capability to have a great experience. So we did write a chapter to answer your question. We did write one chapter in the book that the public will see, and it's called Dear Colleagues. It's really just a message to, you, me, our peer set about what we need to do. And basically it's like, we're doing too much talking and not enough action. So quit the talk and just put it into action. And then we give really good examples on how to, I think empathy is part of someone, but it can also be taught. So empathy be caught and taught. So we give some ideas about how to develop an empathetic culture, and especially within tech So that's really important aspect of it. We talk a little bit about, you should be leveraging different digital capabilities. And I think most people already understand that, but we sort of encourage people to sort of double down and start doing that, allowing the patient to drive their care, including them in shared decision-making, things that are, nothing is like, whoa, that's such a new concept, but it's a reminder of all the fundamental concepts, except for that empathy one. We're really big on that. Empathy is really critical to a great patient experience. And if you're not taken care of by empathetic people, which includes tech, that can be hurtful to the experience. So that's part of it. It's really, if I summarize that part of it for you, it's really what we're trying to do is connect the brain to the heart. We know our readers, we know our peers know that it's all about the patient. It's about human-centered care. We know all of us articulate that in our brain, but our job in that book and that chapter is like bringing it down to the heart level, because that's when real change happens. You can have intellectual curiosity, intellectual understanding, but change doesn't happen. That's what we've been doing for 20 years. Oh yeah, everyone talks about patient experience, like we said a couple of times now, and we're very slow to do it. But when it gets into the heart, that's change happens. And so we give a lot of ideas, like have patience at all your meetings. I mean, how many IT, like I'm just picking on tech,
right?
But how many of our IT organizations have patients at their town hall talking about, we do it at Divergent, and we're not in the hospital. We serve many hospitals. We're not in the hospitals. So have patients talk, listen, bring in clinicians. No one wants to see PowerPoints, of the CIO talking or the CDO talking. They get enough of that. They want to hear, they're going to remember the story of that patient that said, you know what, because of what you did with that portal, that new feature, allowing me to see my lab results instantly changed my life. They'll never forget it. And Dr. Roxy, I know we're sort of limited in time, so I won't go into any more stories, but I could tell stories that would make all of the listeners cry. True stories, how it just changed our IT staff, our team, and then we had demonstrable patient experience happen in our facility.
Yeah, absolutely. I mean, there's so many organizations that are patient-centric and have never had one interview with a patient when they are developing their product roadmap. And so that's just always, that's one of my soapboxes that I talk about on the show often. So as we're thinking about the patient experience, how do we, so you gave one example of integrating them into the meetings more, but are there some organizations that are integrating patients more and embodying that empathy? And maybe even, I would even venture to say that organizations could use empathy as a competitive advantage if they really made it part of their culture. So are there any organizations that are, when you say that, I think of Southwest, and for some reason, that's just like the love, empathy kind of, and that's not healthcare. That's an airline for crying out loud. So are there any organizations that really just stand out to you that are kind of embodying parts of that or all of it already?
Yeah, well, I can speak to my former organizations, and they're still doing these things today. And, some of the things, not only is formal empathy training, because like I said, it's taught, but formal empathy training. And then, not only having patients speak to us, but serving in patient care. So, so there's several organizations, that I formally have been aligned with, and I've shared this many times. So I imagine it's happening in other organizations. I just can't give you any names, but we spend at least one day a year full time in those organizations on the clinical side. So a quick example, and these are all real. These are all real examples. There was no one is excluded or can get out. Everyone participated one day a year. And you think one day a year, big deal, but you multiply that, you do it for 10 years. That's 10 touches. But I've got two really good ones, trying to remember or think of the best one. But let me do the one of my administrative assistant, Dee Dee Bell McCall. So she chose an inner city hospital of ours to do her one day a year. And she chose, because she couldn't have a baby herself, she chose to go to delivery, labor and delivery. So, we organize this and everyone signs paperwork or all that stuff. Patient, acknowledges, writes down, yes, I'm fine having this person here that's not part of my clinical care team. So all that's taken care of, HIPAA, all that kind of stuff. But she helped. So in the all 7 years that I was there with her, every time she got a single mom. It just happened. Had no one, had no family. So she was there holding her hand, helping her in the birth process. So when you ask Dee Dee Bell McCall, Dee Dee, what do you do at Texas Health? She's not going to tell you that she's the executive assistant to the CIO. She's going to tell you she delivers babies.
Wow.
She's delivered 7 of them, and maybe more since I left. And so she gets it. And so they get like so enthused, and they come back with new information about what can I do? You know, I give you other examples, you know, but they literally come back and we collect all this information. Like, what else can we do as IT? I had no idea that they had to walk 5,000 feet just to get something off the printer or, you know, something like that. So we redesign as a result. So it just, that makes a huge difference. And we saw it we saw a correlation in our Gallup scores, like, you know, how satisfied are they at work? We saw an increase. Now, I can't attribute the science one-to-one to all these programs, but I think they definitely had an influence. So they wanted to work there. We had the top scores. We had the top customer satisfaction scores of any department. We were the number one. So Dr. Roxy, this one I'm really proud of too, because I got a call one day from the medical staff, the director of medical staff. And I was like, oh my gosh, you know, because normally there was complaints about some system and, but I'm ready. I'm like, take a deep breath, pick up the phone. George. And George says, hey, Ed, I just want you to know that we just got the survey back, the physician survey. This is the annual physician survey, in which bonuses were based on. And IT was the highest rated division in the entire health system. Wow. Never happened. And the reason was because my team got it. And then one last thing, Dr. Roxy, for those, you know, because I know a lot of executives are listening as well. We as executives need to do this. I mean, I know this example is going to be extreme, but if I did it, anyone could do it. So when I was at the Cleveland Clinic, I spent 1 day a week from 5 a.m. I had the morning shift, 5 a.m. to 1 p.m. in the OR. I was an anesthesia tech, so I recertified, was an anesthesia tech. You don't have to be an anesthesia tech. You can do anything. They will take you. And it was the greatest experience ever for a wide variety of reasons. And it always reminded me, I'm not here because, oh, I'm some executive at the Cleveland Clinic, or, you know, I'm sitting in an ivory tower. I was down there scrubbing. I saw patients. I saw fellow anesthesia techs. I saw clinicians. I saw what we do, and that's saving people's lives. It gave me all sorts of new ideas. And another easy one, that was a little harder, but an easy one that I also did was volunteer. I volunteered for years. I included my kids. So I knew what a hospital was like, but you really don't. See, people say, I don't need a patient because we're all patients. No. None of us are the same.
That all the time, all the time.
It's wrong. And it's the same. So volunteer, bring in, and, you know, people say, well, I don't have time. Well, bring in your kids. And my kids have all been through all the hospitals where I served. Volunteering together, it was a wonderful, you know, parent thing. And then it always just breaks your heart. That's what I wanted to happen. I wanted my heart broken every time I walked into that room. I saw this kid that was going to die, or this elderly person that had no one to talk to. Is like rip my chest open, take out my heart, and remind me why I do what I do so that I can do the right thing. So anyways.
That drives change across
totally.
an organization. That drives transformation across an industry. That's for sure.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
So I want to switch gears just a little bit because there's so many people in our audience that are digital health innovators, whether it's virtual care, remote care monitoring, you name it. And they are they're at different stages of the commercialization journey, and they are looking to break through, whether it is with a pilot engagement or whether it is with paying customers. So let's just kind of tap into some of your insights around I know each sales journey is going to have different stakeholders that they're going to be targeting. But overall, what are some of the lessons learned that you can share with our audience of how are they going to break through the healthcare provider ecosystem to actually get in front of the right people, have their message be heard, so that way they have more success of being able to transform healthcare?
Yeah, that's a tough one because you're right. There's these great companies, and they have got great things to do to help us save more people's lives. And it's so hard to break in because of all the tradition and things like that. So I think, is a change up in approach. So I know not all of these are going to work, but for some it might. But one is sort of that collaboration or partnership and saying, hey, I know you're a pretty progressive CIO there or CDO or VP, and can you help us? Let's do this together to redo, GI, the digital technology in GI. And then do this as a partnership, because the win for the CIO, let's just say the persona is the CIO, is that they want to be seen as innovative. They want to do something innovative. So they work with this third this new company comes in, and then they connect them with the GI group, and then they all work together and try and see if they can make something happen on a small scale. And I've done that a few times, and I think that's very effective because I wanted to do innovation, and I knew I had pressure to do innovation, and I wasn't going to be doing innovation with my sort of incumbent big system. So that was good. I'd always find an ally, like, a jock in GI in this example, that wanted to do something. The other thing is, and I've seen some progressive organizations do this, and I'm thinking right off the top of my head of Moffitt, my friend Santosh there, and he's doing something like that where they're inviting all of these sort of startups, who are interested in cancer, how to help with the moonshot, and eliminate cancer, and creating this sort of their own little show, if you will, and allowing these companies to come in, and then they let them pitch. So there's creative things that you could do. Here's sort of a hack, if you will, a little twist on your question that I think might be helpful, is try to find time with a CIO or whoever you're targeting that doesn't cause them to lose time. And so what I'm talking about here is maybe they run. Maybe they're a runner, a jogger, and it's like, hey, while you're doing your 5K, I'd love to do the 5K with you, if you're a runner.
Yeah.
I've done that a lot. I mean, a lot. And the only thing I would not recommend, I tried it once, bad idea, is we did it in a spin class. And of course, we sat in the back of the spin class, but the other people in the spin class weren't too happy that we were having a conversation.
Talking shop the whole time.
So that wasn't good. But I've done a lot of these sort of off things, that didn't require a lot of time, or it could be a walk. So I'm not saying everyone runs, but maybe it's just you walk or something. So find out what that person does. And that's the other thing, is hyper personalization. It's like, because that's what patient experience is all about. It's like hyper personalization. So if you know something about me, because everyone has some sort of ego and they want you to know about them, and if you can appeal to that part of them, you might get it in. And I've done that before. I'm into triathlon, and there was someone who was actually in triathlon, and they were talking about, hey, I know that you're in triathlon, and this is extreme example, but I think you're getting I think the audience will get what I mean about personalization. But it was, I did a lot of racing for adventure races, and this person was an adventure racer. And so they're like, hey, I know sometimes someone on your team drops out or whatever, and, use me, I'm happy to do it. And sure enough, we had a person that dropped out. We had, these are 5-person teams, and she joined our team, and she became like this rock star of the sport eventually. And, but we had time together. And again, that I know it's a little extreme, but maybe it's a foodie. Maybe the person's a foodie, and definitely you can do a more traditional type dinner or whatever, but find something out. I never responded to, and I know a lot of my CIO peers will say the same thing, never respond to emails and everything like that. But if you could get that hook, like that common piece, and if you do your research, you can find it. So if someone knew about me, I was more likely to respond because I just wanted to reward them. For that. And that's exactly what happened in another case where I used to have office hours around the city. So I'm in DFW, and in every other Thursday night, I would be at a different sort of like bar, not to encourage people to drink, drink too much, but I would go to different bars around town for my team, and my team could come and just talk to me, because not everyone, some people are afraid of the CIO, right? So they don't go to your office, but maybe the member of your team will, you're in their neighborhood that Thursday, and it's just chill, and they don't have to drink. They could have a soda or whatever.
Sure.
And then just hang out. So this person, I said, hey, I'm at this hangout, you can come. And they did. And because they knew about the different things we were doing. And that led to them getting some initiative going. So those are a couple other ideas, related to your question, that might be helpful to people.
I think it's brilliant and so valuable. It's not going to be these mass media automated marketing campaigns where you're blasting 1,000 emails or more, or blasting, 100 or hundreds of LinkedIn messages and, thinking that it's just a numbers game and I just need to spam them more often. I mean, I have a lot of empathy for CIOs and CTOs because you've got 100,000 plus startup entrepreneurs that are trying to sell you their stuff. So I imagine it is like drinking from a fire hose and trying to figure out what's valuable, what's not valuable, and what do you need for the specific strategic initiatives that your organization has this year. Versus, what are like ignoring a lot of the other noise. So that way you can really just get your job done and not be overwhelmed.
Yeah. And a couple other things, Roxy, if you don't mind, that might be helpful, is don't come in with a bunch of people and don't come in with a bunch of slides. So if you do get that entry point, be a listener. And when you throw out a big slide deck, you're not listening, So I know you've got something you want to sell and you can talk about it conceptually, or we sort of had, when I was at the Cleveland Clinic, we got it down to 3-slide rule. At Divergent, we have a 2-slide rule. We don't even use PowerPoints anymore. We'll send you 2 slides afterwards. But we try to, if
you just cursed, Ed, I'm sorry, but I'm sure the ecosystem is like shuddering right now. What do you mean no PowerPoint?
Yeah, I tell you, I would sit there as a CIO and I would check out and I would actually count the time. And I'd be like, hey, we've been meeting together. Like, let's just say it was an hour meeting. We've been meeting together for 50 minutes and you just now stopped and asked me.
Oh my gosh.
And I would check out but here's another idea, for all these startups are typically very focused in a particular area. Let's go back to GI. So let's just say GI, but the startup community, the other people that maybe are working on oncology solution or OB solution or, something else. And think about this, really study the organization. That's another thing that lacks. What are their strategies? That's all out there. Everyone's got their strategy out there, or you can look on great programs like yours and find out what people are doing and thinking. Yep. Then find out, wow, what are the 3 top initiatives? And then, it's probably not all GI. I'm just using GI example since it's Colorectal Awareness Month as we're recording. But maybe they got a new oncology hospital opening up, a cancer hospital. So maybe get a couple of your friends that are doing these other very innovative things in their startups and covering 3 areas, and then going to the CIO and say, hey, we know your 3 strategies are opening up your cancer hospital, your new GI capabilities, and your cardiovascular in London. And I've got 3 people you'll want to meet. And then I could be thinking, wow, okay, I do need some innovation. I do want to listen to this ecosystem, and I can kill 3 birds with 1 stone. And they know me. Wait, they did their research. What? They know what we're doing. So there's some differentiation that could help.
Gold. It's gold, Ed. Okay. So as we wrap up here, is there anything else that you want to share with our audience that you think could be a lesson learned or maybe even future focused of what to look for going forward? Knowing that this show really focuses on the commercialization of innovation from the enterprise system to the startup.
Yeah, I would say, know your audience. So that's been sort of reinforced here already. Yeah. The second thing is really be patient and clinician centric. And, the rub against many startups is that they're great ideas. But how have they incorporated the patient clinician in that? Now, some startups have clinicians in them, which is great. But I would use that as a banner, only if it's true, not for manipulation. It's got to be from the heart. But man, if you are incorporating patients in your design, you need to make that front and center. If you're incorporating clinicians in your design, you need to make that front and center. If you're not doing those, you probably shouldn't be in the business. But
agreed.
But that's what you should do. And then you should tackle it from, because it makes a difference. And again, only if it comes from the heart. If you manipulate this, you'll be found out and you will not be successful. But the empathy, right, that Dr. Roxy, you and I have been talking about, it's like you got to be doing it for the right reason. Yeah. Man, to save people's lives, to improve the quality of someone's care, or to reduce clinician burnout, whatever the theme might be. But you've got to be doing it. You got to be missional, I guess, is a way of summarizing it.
Yeah, that's fantastic. So Ed, if someone wants to connect with you after the show, or where they, and also share, where can they find your books and the one that's coming up in the near future?
Yeah. So LinkedIn, is probably the best, easiest place. Divergent.com is for our company. And yeah, the books, I think on Amazon, you can just look up my name, and I've got 5 or 6 titles out there that you'll have access to. And again, all my books, all of them, the profits go to cure cancer. My mom died of cancer many years ago. Little did I know I would have cancer soon thereafter. So everything goes to cure cancer.
Awesome. Being missional. Love it. Thank you so much for joining me today. I appreciate your time and your wisdom.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.